My name is Chris Dietrich, and I work as a medical science liaison for Aquestive Therapeutics. And just briefly, we provide medications for patients in the epilepsy space. Prior to this, I worked as a physician assistant for almost 18 years, predominantly in neurosurgery. So that's kind of where my neurology background comes in. And then I've been working as a medical science liaison for the last 3 or 4 years. And we've been doing a lot of these presentations with the epilepsy alliances and foundations. And in doing so, we've kind of realized that there are a lot of questions involving unmet needs and the medications that are available. And then there was a paper that came out from Dr. Goodall, who's a PharmD in Wisconsin, that specifically addressed this topic. And so what we decided to do was to put together a presentation using some of this information and putting it out to all of you guys to help educate and update all of you on what's going on regarding seizure clusters specifically. So the agenda today, this is sort of the agenda, but we may stray from this agenda, and that's fine. There's not a problem there. But you can see we kind of go in an order where we're going to give some background regarding seizure clusters and giving a good definition of what that is, so we all kind of know what we're working with. Through the presentation, we'll discuss the different factors that increase your risk for having seizure clusters, but also understanding the importance around managing seizure clusters. And then we'll dive deeper in discussing the management. What are the different ways to manage seizure clusters? I'm going to harp again, as I did in our other presentations, about the importance of a seizure action plan and having an updated and solid seizure action plan. And then at the end, we'll briefly discuss rescue medication options related to seizure clusters. So a little background about seizure clusters. As you can see in that first bullet point, approximately 30% of patients with epilepsy, so anybody on that epilepsy spectrum, experience uncontrolled or poorly controlled seizures despite taking their medications. So think about that. You've identified your triggers, you're taking your medications every day as scheduled as you're supposed to, but 3 in 10 or about 30% still have seizures. The problem is it's not really clear why this is happening. There's some theories and thoughts out there about why this is going on, and you can see those listed below. We're not going to go into all these potential pathogenic factors, but just understand that it's not clearly understood why this is happening, and we're still trying to figure it out. And that last bullet point, talking about the range of prevalence, it's broad because we're still trying to gather data. We're still trying to understand. And you can see, though, whether you're outpatient or inpatient, that range is pretty similar. So even if you're in a inpatient and being monitored, there's still a good prevalence there compared to outpatients or people that are, not in a hospital setting. So that's some interesting, I found as being some interesting data. So how do we define seizure clusters? Well, the typical definition is 2 or more seizures within 24 hours, which falls into the idea that you're having bouts of increased seizure activity. Other terms that you might hear that are the same as seizure clusters, you could have acute repetitive seizures or serial seizures, seizure flurries. These are all terms for the same condition. And so what you might recognize them as are these closely grouped repetitive seizures, but you typically have a recovery period between these group of seizures, and it can be any seizure type, and the severity can range from being very mild to being severe. And you might have one that's mild, then the next one's severe, then the next one's mild, and so on and so forth. But just understand that it's increased seizure above what your baseline may be. So just keep that in mind. Nope, it didn't go. There we go. So if we take that a step further, so having these seizures clusters, what does that burden look like? And you can look at it multiple different ways. From a social and mental being, it affects quality of life. It's negative. It can be negatively affected, and certainly the severity of the seizures and the frequency can affect that. And so, as you think about it, if you're having increased seizures and your seizure activity is sort of sporadic and it's not as predictable as it normally is as you're at baseline, you're going to be worried about going out places, going out to eat, going to the grocery store, doing those things, you're going to have this kind of overarching kind of concern about going and doing those things because you're concerned about having a seizure event while you're out. And so from a social standpoint, it can negatively affect you. But then there's also the physical aspects. You can injure yourself having a seizure. You can hit your head. You can break your arm. Any of those things can happen. And then if you take that a step further, you can look at it from a financial standpoint. If you're concerned about seizures and not being able to go to work, then that can affect you from an income standpoint, which then, sometimes, unfortunately, when an employer knows that you have epilepsy or you have seizures, a lot of times they may not tell you that they're letting you go for that reason, but it does happen. And we hear about patients with seizures being let go from jobs. And so then there's also, from a healthcare standpoint, the cost of managing patients with seizures. So the medications and the hospitalizations and the monitoring and stuff like that also add up. And so, as you can see in that last point, 70% of patients with seizure clusters report an association with negative career effects. So there is a big burden on just your life as a whole with having seizures. And all of you know this. I don't think I'm telling you anything you don't already know. But again, I just wanted to reinforce that as we go into this discussion. So what are some of the factors that can increase your risk for seizure clusters? And we're not going to go through all of these. We're just going to hit on a couple of highlights that I think are important and things to keep in mind. Well, obviously, the more severe your epilepsy is, but then on top of that, the worse the seizure is controlled, the increased risk you are of having seizure clusters. Also, if you have a history of status epilepticus, that can be a problem. If your seizures are becoming more frequent, so it used to be you would have one every 2 months, and then it became once a month, and once every 2 weeks, that pattern can put you at a greater risk of developing seizure clusters as well. If your seizures are lasting longer in terms of how long the seizure lasts, that can be a predisposing factor. And then if your epilepsy started at an earlier age, that too can also increase your risk for developing seizure clusters, along with some of the other items mentioned here. So recognizing your seizure clusters and triggers. And I know in presentations that I've given in the past with you guys, I really harped on these points because I think it's really important, because it's one of the few things that you as a patient or a caregiver can control in some way. So obviously maintaining a very clear history on what happens when there's a seizure event. So what was going on before the seizure happened, what happened during the seizure. So how long did it last? What did you notice was going on during the seizure? How long did the recovery take after? What kind of symptoms did you have after the seizure? So really obtaining a clear history. Seizure diaries. I'm hoping all of you have a seizure diary, whether it's online, whether it's paper bound, it doesn't matter, as long as you're able to keep a good seizure diary to, again, keep track of your seizures, but it also allows you to look for patterns. And if you can identify those patterns or certain things that trigger your seizures, then it allows you a way to prevent them. And so some of the triggers I have listed below that are not uncommon. And so sleep deprivation, I know this is a tough one. Some of the medications that you take can sometimes make it difficult to sleep. And so you get sleep deprived and then you have seizures, and it can be this cyclic sort of process. Alcohol sometimes can trigger seizures. The biggest one probably is skipped or missed medication doses. This is, I think, the one thing that you all and the caregivers can control is making sure you take your medications on time when they're scheduled. And so really staying on top of your dosing and not missing medications are important. Stress, doing your best to manage stress. I know it's tough, especially in an environment like this with COVID-19. It can be a little more stressful. I know with COVID-19, sometimes there's difficulty accessing physicians, and then there's the stress on being able to get refills on your medications for your epilepsy and managing your seizures. And so that can become stressful. So that's always a problem. And then you throw in illness. It's the winter time. You tend to see the flu. Obviously, there's always the risk of COVID-19 and other illnesses. So all those things and trying to manage those things are important to help prevent seizures. Some other things, why? So the key thing is, why is it important? Why should I have to be concerned about managing seizure clusters? First and foremost, they don't typically stop on their own. You have to intervene in some way to get them to stop. And that's usually by medication. Ideally, if you can manage it at home, that would be ideal, as opposed to having to get an ambulance, going to the hospital and having them address it there. That's a long period of time where you could potentially have additional episodes of seizures. Obviously, the other concern is that it can progress or evolve into status epilepticus, which is also a concern. And obviously, if you've had a couple of bouts of status epilepticus, again, as we talked about in a couple of slides prior, this can cause a higher prevalence of patients developing seizure clusters. Obviously, they can be disruptive to life. We've already talked about that, trying to get out, going to do things. If you're having these seizure clusters, there's the worry of going out and having a seizure. And then as we talked about the healthcare burden, it can add to that. Because like I said, you could end up in the hospital, being treated in the hospital. There's a cost associated with that. I think this is a really important slide, because I don't think this is discussed enough, and it may not be understood, not necessarily from the patient and caregiver side, but also from the physician side, understanding that there needs to be a two-way street of communication and discussion when it comes to treating cluster seizures. So you can see in that first bullet point 1, having a seizure action plan. 70% do not have a seizure action plan. I'm hoping with the group on here that it's 0, that all of you have a seizure action plan. But if you don't, I would encourage you to develop one. And then there was a study, I believe it was done in 2017 with Dr. Penovich, where she had a study involving adult patients with seizure clusters, and just talked to caregivers and clinicians and extrapolated some data from that. And part of that was that 20% of the patients reported that they would take rescue medications in response to a cluster. So only 2 in 10. So that's 8 out of 10 patients would not take one. So why is that? Is it that the patients are reluctant to take it, or is it lack of education from a provider standpoint, or is it a combination of both? And I suspect there's probably a combination of both that lead to that number. And so trying to bridge the gap between clinicians and patients are important. So if you look at that, 52% of clinicians reported the majority of their patients had a seizure action plan in place. Well, if you look at the first bullet point, 70% of patients did not have one. And so there's a lot of miscommunication. And so I think really making sure that you have a good, open conversation with your physician or your nurse practitioner, or your PA, or whoever you're seeing, is vital to making sure that you can manage these seizure clusters when they occur. So treatment for seizure clusters. So from a practitioner standpoint, so if your doctor, your NP or PA, or somebody like myself, what are our goals in trying to manage this? What are we trying to do? So one, we want to make sure that you have a treatment that you can administer regardless of the setting. So whether you're at home, at school, at work, regardless of where you're at, that you're able to administer this medication to avoid being hospitalized. And secondly, with any medication, you want to find the lowest effective dose. So the lowest dose that we can give you that's the most effective, that gives the least amount of side effects, right? So if we can give you a medication and it's only 2 milligrams, you have very little side effects, but it manages your seizures. Well, that's what we want. Now, does that always happen? No, but that's typically the goal. And so what are our options treatment-wise? And you can see there's a huge list of options there. Diazepam rectal gel, a lot of people are already familiar with that. They may already have that as an option for them. You could always do second and third doses of medications that you're already taking. So your maintenance medications, some people can take additional doses of that. There's intranasal medications, which we'll talk about here shortly. Some off-label uses, there's oral benzodiazepines and some compounded products, again, which are off-label, but people do go that route to manage some of these seizure clusters. And then a diazepam dissolvable strip, which we'll briefly at the end of this talk about, which will hopefully be a potential option in the future to help as well. So we're not going to go through this a whole lot, but just understand, again, from a provider standpoint, there are other factors when it comes to trying to figure out what's the best treatment for the patient. So rate and route of administration. So is a rectal administration or dosing for this patient the best option? Well, it may be, it may not. It just depends on that patient. You also want to find a medication that can be absorbed the quickest to get to therapeutic as quick as possible, right? So what can be absorbed the fastest and stop that seizure the quickest? Portability and ease of administration, right? So you want to be able to have something that you can use outside of the home potentially. So when you're traveling or going somewhere, you can take it with you to help manage those seizures. Something that has a good shelf life, right? You don't want it to expire every month and then you have to go get more of it, or every 3 months. You want something that will last a long time, so you're not constantly trying to remember to go get more if it expires. Obviously, you want something that adults and pediatric patients can both take. So dosing that can cover both ends of the age spectrum. And then obviously safety, regardless of what medication it is, whether it's from our company, from some other company, it doesn't matter. You obviously want safety to be involved. You want patients to be able to take the medications and feel safe and know that they're safe taking that medication. I'm going to harp on it again. I'm sorry. Seizure action plan, super important. Hopefully all of you have one. The image on the right was taken from the Epilepsy Foundation's website. On their website, there's a bunch of other forms that you can print off, the diary, a to-do list, a way to keep track of medication scheduling. I know a lot of these things you can also find as apps as well, but just know that these resources are available to you to help manage seizures. So also keep in mind that it's not a one size fits all with any of your medications. It's tailored and individual to you, the patient, because everybody's different. What works for one isn't going to work for the other. And just because two people are taking the same medication doesn't mean that the same dosage of that medication works for both. So we could have 5 people, or we could take 5 people randomly drawn from this meeting, and you're all going to have a different seizure action plan. The medications you take are going to be different, and how you implement them and what you do, it's going to be different for all 5 of you. So just understand that it's tailored and individualized to each of you. And it may be that there's going to be some trial and error of what works best for you in terms of finding the best approach to manage these seizure clusters. Make sure also that whoever's around you that potentially would have to treat you, whether it's caregivers, whether it's family members, friends, and it may be that your caregivers, all of the above, right? Coworkers, knowing that they are trained and know what to do, and in the event that you have a seizure cluster. And then when you look at it from a medication standpoint, from safety, obviously injections, there's always a concern of the use of needles, excuse me. And if you're seizing and somebody has to use a needle, there's some, I know if somebody was having a seizure and I had to inject them, that would be sort of a scary proposition to make sure that you're doing it correctly. There's intranasal products, and they have their pros and cons, and we'll talk about it a little bit more in the next slide. But sometimes you can have some irritation and some intolerance to something being sprayed up your nose. And then rectal application, there's always concern of trauma when administering the medication. So these are the different routes that are available currently. And I just talked about them on the previous slide, but these are just images so you can kind of get an idea of what the rectal administrator looks like all the way to the left, and then the 2 nasal preparations to the center and right, just so you can kind of get an idea of what they look like and how those medications can be delivered. So if you wanted to kind of put them side by side, the gel versus the nasal preparations, these are sort of the pros and cons of each. If you look at a rectal gel, the pros, it's been around a long time. There's a lot of data that supports it. It has a good track record, and there's a lot of familiarity with it. And so there's a lot of pros to being sort of that first one that was out to market. But obviously it has its drawbacks, right? There's just the social stigma with giving a medication rectally, so whether you'd have to administer it yourself or somebody administers it for you, there's some reluctance there to want to do that. Oftentimes you have to have the patient lie on their side, which can be difficult depending on the patient. If they're wheelchair bound, obviously if you have a large obese patient, that can be difficult to administer as well. So then more recently, nasal preparations came along as a new way to give medications that weren't rectal. So the nice thing is that they're small molecules, they cross into the blood-brain barrier much easier. It's less complex to administer than a rectal gel. Some of the drawbacks, there's no data in terms of self-administration, so it's unclear whether it's safe for you to give yourself if you're able to do so. And it can be kind of difficult from a portability standpoint to carry them around. They're a little bit bigger. Oftentimes you have to carry 2 of them around, and so sometimes that can be a challenge with the portability aspect of it. And so that brings us to diazepam buccal film. And so just before we get into this slide, just to understand that Aquestive, so the company I work for, we're putting together data on this preparation with the goal of submitting it to the FDA shortly, with the goal of having the medication out potentially by the end of the second quarter of 2021. And so what it entails, it's a dissolvable strip that would be placed in your mouth. And we already have other medication that is a medication that comes on this dissolvable strip. And so the idea would be to take diazepam, which is in the rectal gel and also in one of the nasal preparations, but have it as a dissolvable strip. It's just a different way or an alternative way to administer diazepam. And so as soon as this becomes available, hopefully we'll have another presentation for you guys to kind of let you know more about it. So just to tie everything together, just understand that seizure clusters are common. They're different from person to person. The type of seizures that you can have involved in your seizure clusters are different from person to person. The key thing is early aggressive management to reduce the seizures, so to reduce the severity, the length, and the frequency of them, which hopefully will prevent additional ones down the road. Each one of these treatment options, though, just remember, are tailored individually, so it's different from person to person. And that's on you and the physician to really look at you as a person as a whole and saying, okay, what's going to work best for me? Again, emphasizing the importance of creating a seizure action plan to really to optimize treating your seizures. Make sure that you include family and caregivers and coworkers and any people that are involved in your life with understanding the risk and benefits of each of the medications that are involved in treating you. There's, again, just to reiterate that there's a rectal and intranasal formulations that are approved for use currently for seizure clusters, and that there are other medications coming down the pipeline, including the diazepam buccal film that potentially will be available later this year.